Guys, you have 50, maybe a hospital do 50 a day or something. They've got a lot of other irons in the fire. So here is supplementing that, and we can do up to 320 a day. Up to this point, before the state started setting up the sites, you had needed to be referred from a physician to a transfusion center, require basically like a prescription. We have now dispensed with that because the Surgeon General issued a standing order. So if somebody is COVID positive, particularly if you're in the high-risk categories, you can make an appointment and come directly. And so you can go on patientportalfl.com to reserve a spot. As new sites are added, you will then be able to do it the night before, but when they add a new site, it takes a little time to populate. So if there's a site announced for Tuesday, you'd be able to do starting Monday. But patientportalfl.com. You can also go to floridahealthcovid19.gov. These aren't the only places to get the monoclonals. Hospitals have been doing it, physicians have been doing it, but you may be in an area where hospitals do it once a week or something, and so this obviously the 7 days a week is a little bit different. The Regeneron that is being used, people should understand, is not going to be charged to the patient. There's no cost to patient to come in. You hear these people putting out a lot of misinformation about it costing thousands of dollars. Just understand the federal government already bought all this out last year. The Trump administration bought the whole stock of it once it became approved for, actually they may have even had a deal in place prior to approval, but certainly it became effective upon emergency use. And so that's already done. So whatever Florida is drawing down, we're just drawing down. We don't pay, and then the patients, are not paying thousands of dollars. You're not going to be charged anything to be able to receive the treatment. So don't let that misinformation dissuade you from potentially getting a treatment that could really, really help you. So who now, and then you look what we've been able to do in a relatively short time. Obviously here in Manatee County, we also have sites in Bay County, Brevard, Broward, Duval County, Hillsborough, Lee, Miami-Dade, Okaloosa, Orange, Palm Beach, Polk, Pasco, and Volusia. And we're going to have more sites coming over the next several days. So probably by the middle of this week, you're going to end up with upwards of 21 sites around the state. But certainly we'll be getting close to 20 at a minimum. And so you figure 320 treatments a day. Multiplied by that. Now we've done thousands of treatments so far. We haven't necessarily sold out, completely booked any of the sites, but it's there for people, and we've had a lot of good feedback as a result of it. The Regeneron that's being offered at this site has been shown to be effective against the Delta variant. Some of the other monoclonals like the Eli Lilly haven't performed as well on that. The Regeneron also is approved for use as a prophylaxis. So if you have somebody that's high risk that's been exposed to somebody with COVID, you actually can use it as a prophylaxis, so like in a nursing home, for example, but even just folks who may be high risk, you can do that. It also can be applied subcutaneously. So most of it, for most of the year, it's been through IVs. There are IVs that are offered at our sites, but if you can do it subcutaneously, it's much quicker for the folks who are working here, and so people can just be observed, but you can have the beds available for people to go in and get the treatment. And so Regeneron's the only one that's been approved for that. So that allows you to get more volume, allows you to do it quicker, and hopefully be able to meet the patient demand for this. Now, in terms of the folks who are the most targeted for this, they basically say if people have an elevated risk of complications from COVID, that involves a number of things. If you're elderly, if you're immunocompromised, overweight, living with diabetes, kidney problems, heart, lung. And I would say if you're 50 or older, chances are you're going to be fitting into one of these. I think most Floridians would. And then obviously, if you're younger than that, you still may as well. So I would just say, anyone that has a better than average risk with COVID, if you do get infected, this is something you can do early and potentially really make a difference. And that really is the key, is the early intervention. When you get infected, most people obviously handle this fine, short of hospitalization. Body creates antibodies. Antibodies fight off the virus. People who generally fall into these categories. Even some people, if you're immunocompromised and you're vaccinated, it helps, but it may still not be enough. So you get this antibody cocktail, and then that really goes to work fighting back. So if you do it early, there's a really strong record here. By the time this progresses to where you would be in serious condition, hospitalized, maybe even in ICU, at that point it's not going to turn it back. So the early treatment is really the key, and this has been proven to be very effective, not only in clinical data, but also just when you talk with people who have had it, it's remarkable. People are really, they feel really fortunate to have done it. You know, I can just tell you on the sites we've done already, we've got a whole bunch of really good stories of people who got it, fever spikes, start to develop symptoms, they go in, and they've had resolution. A lot of them have had resolution very quickly. So we appreciate that, and we think that this is going to be something that's going to make a big difference. So 7 days a week, 9 to 5 here. We'll be doing some more sites, but as of now, we've got a pretty strong footprint throughout the state, supplementing what our healthcare systems were already doing. And I think now there's definitely more visibility on this. More people are asking. And again, this is just one tool. It's not to the exclusion of anything else. This is for people. The fact that this is here should not mean that you don't get vaccinated, but the fact that you're vaccinated does not mean that you may not get infected. I think we're seeing more and more breakthrough. So one thing I can tell you though, in terms of the data, pretty much every hospital, I'd say it's a minimum of 80% of the patients that they admit for COVID are not vaccinated. In some hospitals, it's even much higher. I'd also say that from the big health systems we've talked to, the people that are admitted for COVID, over 90% of them, regardless of vaccination status, did not get the monoclonals. And so I think a lot of it is they just didn't know to ask. They got infected. They hoped that it maybe would resolve, get worse and worse, then finally they got to get admitted. And had they done this, I think a lot of those folks probably wouldn't have been admitted in the first place. So we think that if people understand this, understand it's available, that will definitely help reduce admissions going forward. And we've already seen a little bit of that in other parts of the state where we started doing this early. So all in all, we're glad that we're able to bring this here to Manatee County, and I think the 320 treatments a day should be able to meet the demand. But you know what? Actually, in Broward, we hit the demand, so we expanded it. We expanded the site internally to be able to do more than 320. So we stand by ready to be flexible. Senator Boyd, did you want to say anything?
Thank you very much, Governor. I would first of all like to thank you, your sense of urgency. As the Governor said, these clinics are opening up all over the state. But this is the best of the private sector and government coming together to solve a problem and to help Floridians. Dr. Petit, who's here in the audience, called me.
He's right here.
Oh, he's right here. Called me Tuesday evening and said, we're looking for a facility somewhere in Manatee, Sarasota County, 10,000 square foot or thereabouts. Can you help me? I called Kevin DeLallo, the CEO of the hospital here. Within a couple of hours, he talked to Philip Reeve, his associate administrator here, and they were on their way. With the governor's team in Florida and the Department of Health, by Friday, we had this set up, and we're able to deliver life-saving therapies to Manatee County and Sarasota County residents as a result. So thank you very much for your commitment to helping us combat this terrible disease, terrible virus, and together we will get through it. I really appreciate your leadership.
Yep, good. And you know, when you have a state that has to deal with a lot of natural disasters, you build up a pretty good emergency response infrastructure. And although this is a medical issue, we really lean on the logistical know-how. And they obviously have a lot of good relationships, and so they've been able to do these sites very rapidly. And then once they're up, they run very well. So we're happy about that, and we're glad we could be able to fill the need. I mean, it was a similar thing that we did when we were doing the vaccine distribution. You know, once there was a county that was lagging, they call. We could go set up a site, knock out a few thousand people in 2 or 3 days, and then figure out where else they were lagging or where else you could go. And that would be done sometimes within 24 hours. We would have big sites set up. And obviously when you have existing infrastructure like this, that makes it so much easier. So we really appreciate the hospital for doing this. It's not only easier to do, it's also cheaper for us to do when we have this. If we have to put up tents and trailers and all that, you know, you can do it, and if you need to do it, you do it. But this makes it a lot easier. So we're really excited that we're able to do this. And at the the end of the day, early is what it's all about. And again, hopefully you don't ever get infected, but the fact of the matter is, this is very contagious, it's aerosolized, so you are going to have positive tests. And what happens then? And you have an option here, and it was an underutilized option, or at least it was underappreciated, I think, from the broader public. Now more people know about it, and I do think it will make a difference, so we're happy to be able to do it. Okay, take a couple questions.
Governor DeSantis, the Sarasota County School Board put in a mask mandate yesterday. Do you have a response to the school board members that voted for it?
Well, I think it violates the Parents' Bill of Rights in Florida, which is state law, and ultimately this is a decision for the parents. If you look at, especially like I have young kids, you look at like these kindergartners, the U.S. is the only major country that is saying that this has to be forced on people by the government. United Kingdom, Sweden, Norway, Finland, the CDC of the EU says these young kids shouldn't be doing it. So I think it's something that the parents should be deciding. I don't think it's something that the government should be deciding, but clearly the U.S. in its approach to this has been a major outlier, and I think you should ask why. I mean, what data are they relying on that's so much different than any other data that we've seen in other parts of not only the other parts of the world, other parts of the U.S. and other parts of Florida, because we have a school year under our belt where schools handled it differently, and the results weren't materially different.
Governor, as a veteran on the war on terror and with Manatee County having so many veterans here, can you talk a little bit about how you're feeling personally, what's going on over there, and what message do you send to the veterans here?
Well, I think it's humiliating for our country what's happening. I think that a lot of people that served over there, I mean, I know people that have served years over there over multiple deployments. A lot of us do. There's people that served and then their kids have served over there. So there's been a lot of blood and effort and tears and toil put over there. And I understand and understand you can't stay there forever. I do think we need to redeploy, but you got to do that by protecting the Americans who are there first and foremost. You've got thousands and thousands of Americans that have really nowhere to go. They're fighting to get out from behind Taliban lines, and I fear that the worst is yet to come on that. Also, the fact that we would be gifting billions of dollars of military equipment to Taliban and terrorist forces, that should have been taken care of. And so all those Americans over there, I think it's really been disgraceful, and I don't think it's the type of operation that is consistent with the sacrifice that so many of our veterans made. Our veterans were asked to go to all kind of places. Now, I served in Iraq, I didn't do Afghanistan, but there were similarities in terms of being in really hostile areas, having to do these different operations, and then hoping that you'd have a decent government. And the fact of the matter is, after 20 years, there's been a lot of failures on the political front, and there's been no accountability that I've seen. Has a single person tendered their resignation as a result of this? Has anyone been fired? Have we seen anything? It just seems like with our national government, if you're part of the Beltway clique, you don't have any consequences. As long as you're part of the in-group, you can fail upwards and keep failing upwards. I think there needs to be some accountability for this. This is not the way we want to see the United States behave abroad, and it is humiliating for our country. I think it's a gut punch for a lot of veterans and active duty, but this is not the way that this is supposed to be handled.
And your message to the veterans?
Well, I thank all the veterans who served. I mean, obviously after 9/11, we had to go and we had a score to settle with the people that attacked our towers and our Pentagon and tried to attack the Capitol and killed thousands of our fellow citizens. And we needed to go in, we needed to rout the Taliban, we needed to rout Al-Qaeda. I wish at that time we probably bit off more politically than we could chew by trying to create some type of government. But I think from day one in October of 2001 when this started till the present, anytime the military has had on the ground a mission, our guys have done it. And the people that served honorably, they served with distinction, and I don't think they ever failed us once. The people that failed us, have been the elites and the people in government and the people in the suits who think that they know more than they actually do. Yes, ma'am. provide the staff. So yeah, we have that, so it's good, and I think most of you guys know, there's a national crunch on staff to be in hospitals and healthcare, and this is something that I think COVID kind of really facilitated. You can be working at a hospital, and then you can get hired by a staffing agency. They'll put you right at the same hospital. You'll be, I mean, like, hey, I don't blame them for doing it, but it's been more difficult for that. But this is fine. We have the space. We bring in the people through Florida DEM, and then they're able to do it and provide it. And they're very mobile, and they are able to flex and do a lot. And as I said, I don't necessarily anticipate that we're going to exceed the 320 slots a day here. But if we do, like we did in Broward, we actually can expand internally, and you have to surge a few more staff and do some other stuff. But we can definitely do that, and we're happy to do it. So, okay, 9 to 5. This is here 7 days a week for folks. We're hoping that this will draw from both Sarasota and Manatee counties. We do have a spot in Hillsborough County and in Pasco. We're working on potentially Pinellas, and then we have one down in Bonita Springs. We are looking to see between Bradenton and Bonita if there is a need to have one in between there. And I personally have suggested that we maybe do need that, but we'll see. But that could definitely be something that we do. And then we will be opening up some more sites early part of this week. So stay tuned. Thanks, everybody.